Okay, so today we're going to talk about something that's really important, but let's be honest, it's often surrounded by a whole lot of silence. We're talking about vulval health. It's a topic where so many of us have questions, but we might feel a little hesitant to ask them. So in this explainer, we're going to pull back the curtain and demystify it together, replacing all that uncertainty with clear, empowering knowledge.
You know, at the heart of so many worries is that one simple question: is this normal? It's a question a lot of us have probably typed into a search engine late at night hoping for answers. So why are these conversations so tough? Well, today we're going to get some real, evidence-based answers to that very question. Let's get right into it.
So here's our game plan. We're going to start with the basics of anatomy, then we'll dive into common issues like itching and pain. After that, we'll walk through what the diagnostic process actually looks like, touch on some broader health topics, and then wrap up with how you can use all this info to be your own best advocate. First up, let's do a quick anatomy lesson. I mean, it's pretty tough to know if something's off if you're not totally sure what's what in the first place, right? Just think of this as the foundation for everything else we're about to cover.
Okay, so let's get our terms straight right off the bat. So often people use the word vagina to talk about everything down there. But actually, the vulva is the correct term for all the external parts you can see. That includes the outer and inner lips, that's the labia majora and minora, the clitoris, and the openings to the urethra and the vagina. Seriously, just knowing the correct names is a huge first step.
Now, here's something that's pretty fascinating. The skin of the vulva is unique. It's not at all like the skin on, say, your arm. Research actually shows it loses about twice as much water as the skin on your forearm. What that means is its natural protective barrier is just weaker. This sensitivity helps explain why it's so much more likely to get irritated by things like soaps, laundry detergents, or even certain types of fabric. And that unique sensitivity we just talked about, well, that leads us right into our next big topic: itching. It is one of the most common reasons people go to see a doctor about this part of their body, and it can be incredibly disruptive, especially when it comes to getting a good night's sleep. So what are the usual suspects here?
Well, there are a few potential culprits. It could be an infection, like candidiasis, which you probably know better as a yeast infection or thrush. Or it could be dermatitis, which is basically irritation from something you came into contact with. And then it could be one of two specific inflammatory skin conditions that we're going to take a closer look at right now: lichen sclerosus and lichen planus. So lichen sclerosus is thought to be an autoimmune condition. What's happening is that the inflammation is happening deep within the skin's layers. This causes the skin to become really fragile and turn white. It's often described as looking and feeling like parchment paper. And as you can imagine, that fragility can lead to soreness and splitting on top of the intense itching. Now, it's totally natural to worry when you hear about any kind of link to cancer. So let's be super clear about this. While lichen sclerosus is associated with a slightly higher risk, the condition itself does not cause cancer. The actual risk is pretty low. We're talking around 3 to 5%. The most important thing to take away here is that getting the right medical management and having regular checkups makes all the difference in the world. The other condition you should know about is called lichen planus. It's also an autoimmune disorder. And what's interesting is that it can show up in other places too. For example, on the inside of your mouth, it can create this kind of lacy white pattern. When it affects the vulva, the main treatment is usually a strong topical steroid cream, which helps calm all that inflammation down. Okay, let's shift gears now. We've talked about itching, so let's move on to another major symptom: pain. Vulval pain can show up in a lot of different ways. It could be a specific lump, or it could be a more generalized, chronic, burning feeling. Either way, it's incredibly distressing and can have a huge impact on a person's quality of life. One of the most challenging pain conditions out there is called vulvodynia. And the key thing to understand about this one is that with vulvodynia, there's no visible rash or infection, nothing to see. The pain is actually coming from the nerves themselves. It's kind of like having a faulty alarm system, where the nerve endings are just firing off pain signals for no obvious reason. And because of that, for many people, the goal becomes managing the pain rather than finding a complete cure. Now, a much more localized cause of pain can be something called a Bartholin cyst. So we all have these glands on either side of the vaginal opening that produce mucus. If the little duct or tube from one of them gets blocked, all that fluid backs up and forms a cyst. Sometimes you don't even feel them, but they can get infected, and that's when they form a really painful abscess that needs to be drained. So for those cysts that just keep coming back, there's a long-term surgical fix called, and it's a mouthful, marsupialization. Instead of just draining the cyst, which means it could fill up again later, a surgeon actually creates a tiny, permanent new opening. They do this by stitching the inner wall of the cyst to the outer skin, creating a new little pouch that lets the gland drain freely from then on. Pretty clever, right?
All right, so you've got symptoms, you've made an appointment. What happens next? The whole diagnostic journey can feel a bit mysterious, but it really follows a logical path. It's all about taking your history, doing an examination, and sometimes running a few more tests to get a solid answer.
A lot of the time, a doctor can figure out what's going on just by looking and talking to you about your symptoms. But what happens when things aren't so clear-cut? Or what if a condition just isn't getting better with the first treatment they try? How do they get that definitive answer? Well, in those cases, a biopsy might be the next step. Now, this isn't something they do routinely, but it's on the table when there are specific signs that need a closer look. We're talking about things like any kind of pigmented or colored lesion, an area that feels unusually firm or raised, a sore that just refuses to heal, or, like we said, when the standard treatments just aren't doing the trick.
I know the idea of a biopsy can sound pretty intimidating, but the procedure itself is usually very straightforward. A Keys punch biopsy, for instance, uses a special little tool to take a tiny sample of skin, only about 4 millimeters wide. It's all done right there in the office with some local anesthesia, and it lets a pathologist get a definitive look at what the cells are doing under a microscope.
Of course, vulva health isn't just about skin conditions and cysts. It's deeply connected to our overall well-being, and that includes our mental and our sexual health. In this section, we're also going to touch on a really critical global issue that directly impacts the vulva and the rights of women and girls everywhere. So one condition that really bridges that gap between physical and psychological health is vaginismus. This is when the vaginal muscles involuntarily tighten up, making any kind of penetration, whether it's a tampon or intercourse, painful or even impossible. It can be primary, meaning it's always been an issue, or it can be secondary, developing later in life, sometimes after a painful experience. It's a really common reason for what doctors call dyspareunia, which is the medical term for painful sex.
Now we need to turn to a difficult but absolutely vital topic: female genital mutilation, or FGM. The World Health Organization defines this as any procedure that involves partially or totally removing the external female genitalia for non-medical reasons. Let's be perfectly clear about this. FGM is recognized globally as a violation of human rights. And it's important to understand that FGM isn't just one single procedure. The WHO actually classifies it into 4 main types. It can range from type 1, which might involve removing the clitoral hood, all the way to type 3, which is called infibulation. This is the most severe form, where the labia are cut and stitched together to narrow the vaginal opening, leading to severe and lifelong health problems.
Wow, we've covered a lot of ground, from basic anatomy to specific conditions to major global health issues. So where does all of this leave us? Well, it leaves us at what is maybe the most important part of this entire discussion: empowerment. Because at the end of the day, knowledge really is power. Understanding your own body, having the right words to describe what's going on, and feeling confident enough to ask for help, these are the most powerful tools you have in your healthcare toolkit. So I'll leave you with this question: how will you use what you've learned today to advocate for your own health, or maybe for the health of someone you care about?